Good day once again. Dr. Yakub is my name, Wildlife Hospital, Abuja. Today we're going to talk about cervical cancer vaccine, series of our health talks. Cervical cancer, as we all know, is a cancer of the neck of the uterus. That's the womb of the woman. And it's one of those very common gynecological cancers that it's actually killing a lot of women, especially in third world countries. In the developed world, they've been able to reduce the incidence of cervical cancer because of widespread use of vaccines. Luckily enough, it's one of those cancers that we know we can prevent by vaccination. So the vaccines are available. Today we want to talk about that vaccine and then who should benefit from the vaccine, who should take it, when should it be taken, and maybe the types that are available in the market today so that people who have access or who want to take it can have access to it. Now, the cervical cancer vaccine is actually a vaccine that is directed at the virus that is responsible for that cancer. We call it human papillomavirus, in short HPV. HPV is the virus that is associated with the cause of cervical cancer in more than 80% of the time. Other causes of cervical cancer will not be prevented by vaccination against this virus. Now, HPV is an STI, sexually transmitted infection, and most people who become sexually active actually have this virus in them. And so, at the time of sexual exposure, most people contract this. And so, because of that, the vaccine benefits people mainly who have not been sexually exposed. But then I'll come to that in details when I'm talk about the people who will benefit from the vaccine more. Now, what are the types of vaccines available? As I said, the HPV virus has different types, or we call them serotypes, and there are some of them that are specifically associated with cancer of the cervix itself, and there are some of them that also cause cancers in other parts of the human body, like mouth cancers, throat cancers, anal cancers, and all of that. And so there are some of the viruses, also the serotypes, that are associated with the causation of genital warts, okay, that is warts in the genital area and sometimes even in the oral area. Now, the vaccines are directed to address or prevent contacting some of these viruses or the serotypes that are associated with these conditions. So in that sense, we have in the beginning, the initial vaccines only prevent against two of the serotypes, specifically those ones that cause cancer of the cervix. But nowadays, we have vaccines that cover serotypes that can cause the other type of cancers that I mentioned earlier. And so there are two common ones in use now. There's one called Gardasil 4 and there's another one called Gardasil 9. Of course, as the name suggests, the Gardasil 4 is meant to prevent development of cervical cancer and also genital warts, whereas Gardasil 9 expand the scope of coverage, and it can prevent, or it's a vaccination against the serotypes that can cause cancer of the cervix. It also covers those ones that can cause genital warts. It also covers those ones that may be associated with cancers of the anal area, the vagina, the vulva, oral cavity, and even the oropharynx, or what we call the throat. So the Gardasil 9 is the one that covers all of these areas, and that also is what is now recommended to be used. Now, who benefits from the vaccine? As I said earlier, the people who benefit most from this vaccine are people who are not sexually exposed. And so for that reason, the recommendation is that to have maximum benefit from this vaccine, children, both males and females especially, should take it between the ages of 9 and 13, hopefully before they get sexually exposed, so that they are covered completely in the event, covered completely or vaccinated completely from getting any one of these serotypes that are associated with these disease conditions I mentioned earlier. So, in the best time to take the vaccine is between the ages of 9 and 13. However, people who have also been sexually exposed uh, may benefit especially from Gardasil 9, because maybe at the time of sexual exposure, whatever strain or whatever serotypes, you may not have been exposed to all the other serotypes that could cause disease in you. So taking the vaccine may help to prevent those serotypes that you have not yet contracted at the time you take the vaccine. So in essence, even people who are sexually exposed may also benefit from taking the vaccine, especially the Gardasil 9 that covers a wide range of serotypes of the virus. Now, how do we take the vaccine? For people below the age of 15, between 9 and 15, you're recommended to take 2 doses 6 months apart. And so, meaning that if, for instance, you take the first dose now, you take the next dose after 6 months. Now, beyond 15 years of age, you should take 3 doses, usually in this 6 months. Usually, the first dose is taken, and then the next dose is taken a month after, and thereafter, 6 months later, you take the third dose. This is believed to protect you from those serotypes, depending on the type you have taken. If you have taken Gardasil 4, you are protected from 4 of the serotypes. If you take Gardasil 9, you are protected from 9 of those serotypes that are associated with these conditions I've mentioned. So it is important to know that, again, the vaccines are available, and it is important that we avail ourselves of this so that we can prevent the very large extent, especially cervical cancer. And nowadays, we're seeing increasing rates of genital warts in adults. And so, if they take this vaccine, it will go a long way in helping them prevent these things. And of course, more importantly, the incidence of cervical cancer may drop in our society when and if we avail ourselves with this vaccine. Thank you very much.